Hello everyone, my name is Mike Reimer and I'm going to talk to you about the public health and the medical professions in Kingston upon Hull around the year 1700. This talk is part of the Heritage Open Day event in Kingston upon Hull for 2020. The talk will cover a variety of areas to do with the health of the population at the time. The sources I've used are in the main Hull and Bristol Provate inventories. We'll look at the public health services and developments, such as clean water, the diseases that were prevalent at the time, medicines available to practitioners, the crude surgery of the time, and the practitioners themselves, their role and status in the local community. The public health statistics of the time are quite frightening to modern ears. In the 1690s, London's total deaths were 45 per thousand in the suburbs and 37 in the richer parishes. In Hull, it wasn't much less, as you can see from the figures quoted here. Infant mortality was 1 in 5 live births. This excluded any stillborn, miscarriages, abortions or infanticide. The total death rates in children in Nottingham were up to a half of all deaths for the period 1701 to 1750. And in Hull, it was not dissimilar. For all deaths, it was up to 66% between 1690 and 1709. To put this into perspective, infant mortality in the 21st century, from the figures for 2015, the worst situations were in the African countries where war was prevalent, and this was around 50 per 1,000 live births. The worst in the world in that year was Afghanistan at 112, whereas in Europe it was less than 6, and in the UK just over 4 per 1,000 live births. The kind of diseases that were prevalent at the time were varied, from bubonic plague, which is the Black Death, through dysentery and typhus and cholera, a range of flu-like illnesses, smallpox, lots and lots of children's illnesses, and even illnesses that transferred from animals to humans, which are termed zoonoses. Many of these diseases were spread because of poor water supply, lack of sanitation generally, and very poor ability to clean houses. These diseases are spread by other vectors, including insects, but of course rats who carried fleas. To give you an idea, this would be worse than the worst refugee camp in the world today, when there would be no chance of any modern medicine arriving anytime soon. The first area of public health improvements we'll look at is the water supply. Before the 17th century, the citizens of Hull would have used the River Hull, which unfortunately it was salty as it was tidal from the Humber, therefore a problem because of the salt, silt laden and contaminated by effluent industrial processes, much of it coming down river from Beverley. It would be contaminated with human and animal waste. But Hull had freshwater streams coming into the town. However, once in the town, they became polluted by the same problems, such as industrial effluent and human effluent, as was using river water. It wasn't until the early 17th century that the Corporation of Hull started to build a waterworks near the Bushtake. By 1700, the corporation owned a third of the shares in that company. The water from the waterworks was piped into the town in elm tree pipes, and then using lead strings to either pumps or into individual houses. But this was very expensive for the individual residents. However, despite the cost of having the clean piped water, many of the residents, the wealthier residents, were complaining that the service wasn't available to them in parts of the town. Unfortunately for the poorer citizens, they still used the polluted river or stream water. Although, as you can see, some, the sort of wealthier artisans, might be able to pay bushmen and sledmen to bring water in barrels from the Bush Dyke to their homes. Overall, the increased use of the purest spring water throughout the 17th century would have contributed to improving the health of the local population. Despite all of this, it was generally considered that drinking strong ale and beer was preferable to drinking contaminated water. With about 7,000 inhabitants confined behind the town walls, clearly sewage and the removal of sewage from the town was going to be a problem. As well as the human sewage, there would be animal sewage, there was the slops, the midden heaps, ash pits, private privies, ditches and streams would be clogged up, the graveyards would be overflowing, and then you had the smoke from kilns and forges. As we've already said, the freshwater streams were polluted. This was typical of other towns, although Hull at least had the advantage of running water on all sides. There were some bricked common sewers, and they were around before 1750, but the situation in 1700 would not be fully established from existing records. The vast majority of the refuse was dumped over the walls at the south end into the River Humber, where a public privy also existed, termed the Bog House. Sewage from humans and animal was often carted beyond the walls if it wasn't put over the south end into the River Humber, and some of this was carted beyond the walls to nearby farms and across the river into Lincolnshire and used as manure. And at this time, householders were responsible for removing their own rubbish, but Hull did appoint a street scavenger. Occasionally, this was a role that was occupied by a woman. And as you can see from the slide, at various times, the bench or corporation gave a job, paid for someone to remove certain rubbish away from various parts of the town. Another major public health hazard in medieval or late medieval English towns was clearly fire, an absolute constant threat. Wooden houses, thatched roofs, in a port such as Hull, all along the River Hull, you've got tightly moored ships, merchants' warehouses. These would be full of grain, timber and inflammable materials like pitch and tar, but also coal and turves, which is peat. Then you've got industrial processes, so lots of fire around. You've got the closeness of the housing in Hull in particular, and this was described by Daniel Defoe in his Tours of England. By the late 17th century, Hull, like many other towns, buildings started to be rebuilt in brick and tile, particularly for the wealthy. Examples still existing in Hull are Wilberforce House, Crowell House and the Old White Hart. These were all built in the early 1660s for relatively wealthy families. And the Hull bench were very keen on restricting the processes that might cause fire and providing with fines for offenders who broke the rules. The idea of preventing coopers making their wares in the night season was because that's coopers firing their new barrels at night, when obviously it's more dangerous having a fire at night than it is during the day. And further, the corporation were starting to buy fire engines, so rudimentary fire engines, by the late 17th century. Clearly, the lighting of the streets and within homes and the heating of a house were exceptionally important, particularly in the winter. Residents who were rated at over 3p per week were expected to provide lanterns outside of the front door in the winter until 9 in the morning. Hull along with some other towns, also provided some street lamps with reflective glass that burnt rapeseed oil. Rapeseed oil predates whale oil, that became popular and was of course a major industry in Hull later in the 18th and 19th centuries. Of the probate inventories that I've reviewed for Hull people, 20% of them mention coal for heating their homes and businesses. Jonathan Snaith was an anchorsmith. You'd expect him to have a lot of coal because he had a forge. A shoulder of coals was around about 2 ton. Several residents would have had turbs and coals and fire elding. Turbs was peat, and there was obviously mention of firewood and even cinders in a couple of houses. So a range of materials available to heat the home.